Disclaimer, for those that have survived the day, I've got a ton of information and not a lot of time, so we'll just go through until they actually drag me off with one of those shepherd's hooks, get me off stage. And can we start at the beginning there? So when Todd first contacted me and said Sammy wanted this one here, you want me on the stage? This pointer. Okay. They first contacted me. First slide. No, it should be just the title slide. Anyway, they said, we want you to talk to dentists about how to do holistic dentistry for the non-holistic dentists. And I went home and told my wife that, and she said, are you kidding me? You want to get tomatoes thrown at you? And so I said, well, it's a tall order, but I'll try and condense it and put it into a version that everybody can be happy with. So we're waiting for that. There we go. So yeah, what a title, right? You never seen that before. Holistic dentistry for the non-holistic dentist, nutrition, digestion, ceramic implants. There's going to be a boatload of information. Don't need to know about that. You know who I am, my family. Next to God, that is my everything. These are some of the objectives that I want to cover in, I think, about an hour. I have definition of holistic, principles of holistic review technology, nutrition, digestion, relation to oral health, look at the literature, and then if we have time, we'll look at some case studies. Okay. The goal, of course, of holistic dentistry is to view the mouth and associated structures as they relate to the rest of the body, because this is connected. Studies have shown that people who don't have a head don't survive very well. Everybody read that study, right? Yeah. Peer-reviewed. Minimize harm, minimize toxic materials, and improve overall health of patients. Okay, this is in tiny print. I apologize, I'll read it. The mouth is integral. There are key nutrients, essential, especially as we want osseointegration to occur. If you want bone to heal, if you want soft tissue to heal, you have to have, as Dr. Dome said, the building blocks. Whole foods and whole food supplements are essential. If our patients are not having that as a regular part of their diet, they're not going to heal, plain and simple. Digestion. Not only do they need to get these foods and supplements into their system, they need to digest those. We cannot absorb what we don't digest. Root canal treated teeth, we touched on that this morning. We talk about the systemic inflammatory effects of cavitational osteonechosis, Ronte's CCL5, dangers of metal alloys, important to have properly functioning jaw joints. The jaw joint is innervated by the trigeminal nerve, which is the biggest nerve trunk in the brain. If patients are banging on that nerve, the auricular branch of the trigeminal nerve, they are going to be into which phase? Sympathetic or parasympathetic? This is interactive too, because we got a small enough group. Sympathetic, totally. And how are they going to digest their food, absorb their nutrients if they're in sympathetic? It isn't going to happen. So we cannot ignore this. Every patient, put your finger there. If you feel joint movement, they need to know about it and what to do about it. And one of the best treatments for disc dislocation with reduction or without reduction is prolotherapy. You can learn how to do that in 10 minutes. And if we have time and talk fast enough, let's talk about it. Well, it's kind of off topic here, but it is crucial. If you're interested, I'll show you afterwards, okay? Because Sammy's going to give me, he's not going to give me any leeway. He's going to say, you're done. All right. Restful, oxygenating, regenerative sleep. If people don't sleep, they get into what's called metabolic syndrome. Anybody read about that in literature? What happens in metabolic syndrome? A1C levels through the roof. Neuropathy through the roof. Insomnia through the roof. Which part of the autonomic nervous system does that sound like? I'm giving you a hint. Sympathetic, purely sympathetic. So if people aren't sleeping well, they're in sympathetic, not in parasympathetic, and they're not going to heal. They're not going to integrate the implants that we just put into their heads. Utilize cone beam, MRI, ozone laser, and other technologies to make diagnoses, appropriate diagnoses, and appropriate treatment plans, and provide the treatment for the patients so that you get a favorable outcome. Use modalities to donate electrons, such as ozone, laser, PEMF, biomodulator, things we talked about this morning. Maintain blood flow to organs using PRF and other regenerative therapies. Nitric oxide via supplements, foods, beets, kale, and spinach. Those are the foods highest in nitric oxide. We need to make sure those are on our plate, the patient's plates regularly. Beets, kale, and spinach. And then use biocompatible materials, not just tolerable ones, right? Do we want materials to be tolerated by a patient, or do we want them to be fully embraced? I'd like fully embraced in my body, please. Okay, remember every tooth is associated with a meridian energy pathway. And we want a closed circuit, so electrons flow, rather than an open circuit where electrons do not flow and organs are negatively affected. As we saw earlier this afternoon, that was an excellent presentation, thank you. Acupuncture, 2019 Journal of Acupuncture, defined as a distal tract of tissue that is affected by organ function. So any organ on one of those chains can have a negative effect on any of the other organs that sit on the same chain. Is a tooth an organ? Absolutely. By Dorland's Medical Dictionary, it has function, blood supply, nerve supply, lymph supply, and I know I missed one because there are 5, but I'm not looking at the slide. Okay, it fits the bill for an organ. So every tooth is an organ. Oh, and function and purpose. Yeah. Okay. There are the meridians we talked about earlier, 12 normal ones, and then there are some other special ones, but these are the ones. Every tooth sits on one of these meridians. This is a little diagram I made for patients because I would get the comment, I'm so overwhelmed with all this information you give me about how the mouth is related to the rest of the body. So I try to simplify it. If the pH of the mouth is greater than 6.8, you'll never get a cavity. It's impossible. So then the question should beg, well, why on earth would my mouth ever drop to a pH lower than 6.8 if 6.8 and above is normal and healthy? So then you look at the next stop, the stomach. If the pH of the stomach is greater than 3, you're going to get GERD, gastroesophageal reflux disorder, because you're not digesting your food. You're not digesting the food because you're not making enough hydrochloric acid. And then you got to figure out why. We'll talk more about that later. How about the thyroid? Why on earth would I care about the thyroid as a dentist? Yeah. An underactive thyroid is going to make the gut slow down. When the gut slows down, you become hypochlorhydric, not enough hydrochloric acid. And when the gut slows down and that happens, the mouth becomes more acidic. So all this work that you're putting into people's heads is a waste of time if you don't look at the rest of the digestive tract. All right, pancreas. If the A1C is high, caries, periodontal risk is high, and this is all supported by the literature. You cannot build good bone if your A1C is high. And by high, I mean over 5.5. 5.7 is the technical medical cutoff. If ingested carbs are not balanced with protein and fat, then the blood sugar handling problems ensue, and you get spikes and crashes, spikes and crashes, spikes and crashes, until eventually your pancreas says, I'm done. I'm not going to make any more insulin. Then what happens? Every other American pre-diabetic or diabetic. It's a tsunami. Okay, about the small intestine, large intestine. Greens for every meal, helps everything move. When you ingest greens, you actually get lots of vitamin K1, which then it should be converted to vitamin K2 by the normal flora in the gut. But if you wipe those out with bacteria, wipe those out with antibiotics, where do your good bacteria come from? We're up a creek without a paddle. And then you've got 3 valves. You've got the cardiac sphincter, esophageal stomach to stomach sphincter, and then you've got the pyloric sphincter, and then you've got the ileocecal valve. If those valves do not open and close properly, then you get stuff backflowing from the large intestine into the small intestine, and what happens? SIBO, small intestine bacterial overgrowth, and then the patients feel like crap, literally, because they can't crap, right? That was a good one. I just thought of that on my feet. That's a big problem, right? Things get backed up. They need to get moving, okay? Let's talk about adrenals. If there's too much cortisol, which is going to happen in what state? Sympathetic, thank you. New York, that's, yeah, just thinking about that raises my blood pressure. Then they get high cortisol, they are not going to make good bone. And we are in the business of making good bone when we want to have osseointegration. Periodontal disease worsens, sleep is hindered, all of this is backed by research, published research. Doesn't show up great here, but if the gallbladder is removed, fat digestion is hindered, and then you don't get those 4 vitamins, which are, say it loud, ADEK, A, D, E, and K. Okay? If the liver is often inundated with chemicals from medications, which negatively affects its production of bile and its ability to detoxify the system. So if you want a copy of this, just email me and I'll be happy to send it to you. It's really good to help patients understand. One of the tenets of holistic dentistry is taken from Weston Price, or many of them actually. He was a godsend for understanding the importance of nutrition and digestion as it relates to oral health. He was actually one of the heads of the ADA before he introduced some of what they thought then were pretty radical ideas. We won't get into that a lot, but he did a lot of research for focal infection. He actually headed the research section of the ADA in 1913. He traveled the world looking at the diets of indigenous people who had not been introduced to refined processed foods. And the bottom line is he found this, incidence of caries, basically non-existent. So what does that tell you about the pH in the people's mouths? It was at least 6.8 or above. And he found significant similarities in all of their diets. 4 to 10 times as much fat and water-soluble vitamins in their diet than in Western diets. Okay? Malocclusion is a first world disease. I can show you pictures of it. I did a few trips to Africa and went to the schools and just took pictures of the kids smiling and did my own little mini Weston Price internship, if you will. Anyway, went over there and every single one of those kids, ear to ear, smile, perfect teeth, not a single cavity in their mouths. Uncivilized? I don't think so. I think we have a lot to learn from that. Perfectly straight. Every single tooth present. So at the time, Dr. Price discovered a nutrient he didn't know what to call, so he called it Activator X, which is now understood to be vitamin K2, which Dr. Dome touched on. Fascinating. So current research, fast forward 100, 120 years, vitamins are crucial for oral health. Low vitamin A equates to poor epithelium, enamel hyperplasia, periodontal disease. Low vitamin D, periodontal disease, poor enamel, dentin and bone. Low vitamin C, unhealthy bones and gums, dry mouth. Low B vitamins. Look at the list. B vitamins cannot be absorbed unless hydrochloric acid is in adequate supply in the stomach. So is it any wonder why there are so many people with these things that we see on a daily basis? And there's a simple test that we can send home with a patient to help them understand if lack of hydrochloric acid is at the root of their problems. The stomach is literally the hinge point of health. Okay, more studies, P. gingivalis. This study basically says the mouth undoubtedly affects the gut. P. gingivalis leads to immune modulation, which leads to dysbiosis, which leads to systemic disease and bone loss. Wow, from one bug. So another study, 2016, International Journal of Orthodontics, verifying actually what Dr. Price discovered 100 years previously. Diet affects facial development. Caries and gum disease are always alarms for unhealthy diet. 2020, diet and nutrition are fundamental in maintaining the general and oral health of populations. This was just barely released from the CDC. Osteoporosis is the most common bone disease in the United States. Look at this statistic. More than 50% of US women and more than 33% of men over 50 years old have osteoporosis or low bone mass. Means every other patient you see over 50 is going to have a bone problem. And we're going to put an implant in their head. We better have a handle on what to do to help that bone be healthier, that bone to be more dense. And one of the simplest things you can do is add vitamin K2 to their diet. Simple supplement, just one tiny pill. All right, dental infection does contribute to gut dysbiosis. I put this in here again because I didn't tell you the rest of the story this morning. So remember the guy that came to me had really bad gas? I don't think I told you, but he said, I have gas so bad that I want to jump off a bridge. He used those exact words. I'm ready to be done. I can't hold down a job. I can't have a girlfriend. My life is a disaster. And I really felt it for the guy once I realized he was serious. At first, I thought he was joking. But remember all the pus coming up. There's the cone beam and it doesn't look horrible. You got a little inflammation down here. So you give him 3 options. Just forget about it. Second option, get it out of your head. Third option, retreat the root canal. Let him decide what he wants to do. Well, he saw that video of the pus and he said, I want that out of my head. And of course, you remember this. Black tissue we call gangrene. And the bacteria in here created gases and other endotoxins that get swallowed down the pipe and then contribute to a dysbiosis. Okay, remember macrophages poop out a whole bunch of TNF alpha. That's nasty inflammatory material. Okay. This study, they actually put a probe, actually a little capsule, that then transmitted a radio frequency to tell the computer what the pH was all the way down the gut. Pretty fascinating. What they found was the normal stomach pH should be between 1 and 2.5. Small intestine, look at the jump between those two. Okay, and large intestine. So if we don't have that huge drop between 6.8 to 1, 2.5 into the stomach, bad things happen. Things like H. pylori develop, protein doesn't get digested, nutrients don't get absorbed. So this is a crucial and often overlooked problem. Up to 1 gallon a day, stomach should produce in hydrochloric acid, have to have it to absorb those nutrients. I'll be real quick on this. Stomach inside, here's the bloodstream. This is a stomach cell, okay? Normally, HCl is pumped into the stomach, hydrogen in particular, through what's this called? Proton pump. You've all heard about proton pump inhibitors, right? They are now so common that you can just buy them at any drugstore over the counter. You don't need a prescription. Okay? And for every molecule of hydrochloric acid that is made, pumped into the stomach, you should also get a molecule of bicarb that is pumped into the bloodstream. Well, if you're not making acid, and the physicians that are prescribing these are assuring that you're not making acid by blocking that proton pump, what are you also not making? Bicarb. If you're not making bicarb, what happens to the pH in your blood? It drops. So instead of being 7.3, now it drops down to 7.2, 7.1, 6.9, and now it's a perfect breeding ground for cancer, systemic infections, low-grade infections, and people just feel lousy. All because we're blocking that proton pump with the purple pill. Okay? No bueno. This is what should happen. It's called the alkaline tide. You should make acid, you should make bicarb. Yin and yang. It's amazing. So every day I'm just amazed at how beautiful this creation is of the body. Dental erosion is more severe in GERD patients. I think that's pretty obvious. If you put enamel in acid, what's going to happen? You're going to pull out the calcium and phosphorus. This is astounding. 2018, GERD affects or has affected 50% of Americans. That's significant. Every other patient you see is going to have some kind of acid erosion problem. Also from that study, only a small percentage of patients that have GERD are aware of it. Most of it is silent. Maybe associated with belching, bloating, vomiting and or nausea, although not always. But where are you going to see it on the teeth? How does it manifest? Dentin pools, anybody ever seen those? Little pools like tide pools on the teeth, most often on mandibular first molars. Okay, look Monday morning, I guarantee you, you will see somebody with dentin pools. I think I have some pictures coming up. Main cause is not too much acid, it is not enough acid, not enough hydrochloric acid. Incidentally, GERD is a precursor for Barrett's esophagitis. Anyone know the incidence of esophageal cancer? Which Barrett's esophageal precursors? The mortality rate is 100%. So we can actually save lives by talking to people about their gut. Awesome. Here are the 8 things that are essential. I'm sure there are more, but these are the obvious ones over which we have direct control that you must have in order to make hydrochloric acid in adequate supply. Balanced autonomic system. I think we've covered that ad nauseum, but we'll talk about it more and more. Iodine, 25 milligrams per day. Zinc, typically patients will get enough of that when they're eating their fresh fruits and vegetables. Magnesium, as Dr. Dome said, you've got to have magnesium to activate vitamin D. It's crucial. It's also crucial in the proton pump of pumping of acid into the stomach. So 2 grams a day, that's a good rule of thumb. Water, half your body weight in ounces per day is a good rule of thumb. Salt, and the good stuff. Don't use the white stuff you get in the iodized salt containers. That's a waste of time and money. Use the Himalayan, the sea salt, the real salt. In Utah, actually, we have a real company called Redmond, and they have some amazing earth products. Potassium, we'll spend a lot of time on potassium because it's so important in vitamin B1. Speaking of potassium, it's the 3rd most abundant mineral in the body. It preserves bone mineral density, so it would behoove us to teach our patients about where to get it in their diet. Yes?
So you have a lot of like synthetics recommended. You take those, is there a supplement that combines it? Because you know there's so many.
Yeah, there are. That's a good question. Do I take all of these? I do. I do every single one of these. Some of them are in some supplements and others in others. I carry a formulary of probably 20 different products in my office because I haven't found one that has everything in it. And there are some things on here that aren't listed on here that are also essential, like essential fatty acids. But yeah, I wish there was a super pill that had it all, but
So there's no 3 or 4 that you can buy.
not yet, no. And I don't know if there is. The best source for all of these nutrients is what? Food. You know, food should be our medicine. Yes? Source of K2, excellent question. I do have a slide series on it, but I may not get to it, so I'll just tell you. It's from Claire, K-L-A-I-R-E Labs. I think it's claire.com. And they make 15 milligram capsules. Yes, 15 milligram, because the current literature shows that to treat osteoporosis, osteopenia, to reverse heart disease, the best dose is between 30 and 45 milligrams, not micrograms, milligrams per day. Now that's food sourced. So are you going to overdose on that? Anybody worried about overdosing on a fat soluble vitamin? Should be, but not vitamin K2 because the half-life is 24 hours. You don't have to worry about it. Yeah. 45,000 micrograms, but 45 grams is shorter, more concise. I don't have a lot of time. Yeah. Yes, D3K2, what I tell patients, take that combination because they're usually built in combination now because most supplement companies understand you don't take D3 without K2. That's very bad. In addition to that, take the extra K2, 30 to 45 milligrams. It depends on the studies you read. The ones that I'm familiar with, which I also have in here, MK4 is the one that's most effective for treating osteoporosis, for making your bones more dense. I think they're both helpful. So I'd find a supplement that's got both of them in there, but MK4 osteoporosis. All right. Let's see here. Look at this intake. 5 grams a day, potassium. That's a macronutrient. 5 grams. Let that digest and percolate. That's a lot of potassium. Okay, best sources, beet greens. I've got some coming up here. Okay, before I show you the sources, look at the research. 2013, 16,000 patients. They checked 97% of that N were deficient in potassium. Does that astound anybody besides me? Yeah, I was floored when I saw this. Okay, hypokalemia, I just found this, is associated with COVID-19. Not a big surprise. So many people are sick because so many people are lacking potassium. Current practices that lead to agricultural crop removal of potassium have led to dietary deficiencies and are unsustainable. There's the problem. Binding the potassium so it can't get into the plants. That is unsustainable. This one, 8,000 patients showed that those that took adequate levels of potassium into their diet actually decreased the incidence of osteoporosis. Wow, so now we got vitamin K2, we've got foods high in potassium that are going to lead to denser bone. Fantastic for osseointegration. Okay, signs of potassium deficiency. Let's see, how many of you this week saw somebody with weakness and fatigue? How many of you experienced weakness and fatigue this week? How many are you experiencing right now? Okay, how about muscle cramps and spasms? Yes, saw that. Digestive problems? Yes, saw that. Heart palpitations? Yep, saw that. Muscle aches and stiffness? You see the trend? People are passing these things off as normal because their physicians are saying, oh, you're 60 years old. That's just because you're old. Or maybe it's because you don't have enough of the macronutrients in your diet. All right, another study. 2017, over 7,000 patients. Dietary potassium intake is associated with increased bone mineral density. Okay, I can understand, one study, 8,000 people. Yeah, maybe they got lucky, but 2 studies, 3 studies, perk up and listen. Potassium intake is crucial for membrane potential and active transport mechanisms. How many cells in the body utilize active transport? Every cell in your body. If potassium is not present to make that active transport occur, right, you've got to have that potassium present so the sodium potassium pump actually pumps. What's going to go wrong? Just every cell in the body is going to dysfunction. Potassium is crucial for all of these things. Most importantly here, we'll focus on maintaining healthy bone density. All right, potassium is the most abundant intracellular cation, and it maintains cellular function. Lack of potassium contributes to high blood pressure and periodontal disease. Potassium balance is paramount in maintaining proper cellular function. Just last year, the USDA came out and said this is a nutrient of public health concern. Did anybody see this last year? Why not? Why aren't we getting the information? Maybe the same reason the oral surgeons aren't reading the information about titanium. I don't know. So there you go. Take a shot of that. These are the foods highest in potassium. And again, make sure your source is good. Go to local farmers, not using pesticides, and yeah. Anyway, this is my favorite because I love beet greens. In 100-gram servings of salad, you get 1 gram. Okay, avocados are pretty high. Be careful with the bananas, they'll spike your blood sugar. Anyway, that's not an exhaustive list, but it's helpful. Okay, food should be our medicine. All right, back to the stomach. On your health histories, you're asking a patient, how long you've been taking these antacids? Oh, only 10 years. Did you read the insert that says specifically, do not take this over the counter for more than 14 days or more often than every 4 months? Why would they put that on there? warning labels because they understand that it's causing a problem. You're not going to absorb certain nutrients. But people are on these for years and years and years and years. It isn't any wonder why so many chronic diseases are going on in the United States. All right, more literature. PPIs leads to impaired bone healing, infections, kidney disease, mineral deficiency, dementia, and pneumonia. PPIs prevent osseointegration. Proton pump inhibitors contribute to crestal bone loss. They're associated with early implant failure. So if you don't have that question on your health history, good time to add it. Do you or have you ever experienced heartburn? Have you taken acid reducers or proton pump inhibitors? Or Tums? Is it in your bedside drawer? PPIs, SSRIs are associated with increased implant failure. PPIs double the failure rate of implants, according to this study. Don't you love it when you answer your own question? It's like, thank you for that revelation. It is awesome. Yeah, anything that you put into the stomach that is going to raise the pH and decrease the potential to break the bonds between amino acids is going to inhibit digestion and absorption. GERD can be treated without PPIs and histamine blockers. Histamine blockers are another brand of acid reducers. I took that series out because I had to really streamline this, but that works on the other side of the stomach, so it blocks the histamine stimulus to produce acid. The most common one is called Zantac. Anybody heard of that? It was recalled by the FDA last year because it's causing cancer. Go figure. What's that? Well, apparently nobody's listening to the FDA right now, so I don't know. Decrease the sugar intake, increase the fiber intake, increase whole foods, decrease trans fats, avoid late night eating, especially of ice cream. All right, there's the burp test I told you about. You put some baking soda in water, you drink it first thing in the morning, and then you time how long it takes until your first burp. If you do not have a volcano, it doesn't have to be that pronounced, of course, but if you don't have an eruption, what are you lacking? Hydrochloric acid, right? And then you're not going to digest your food. Do that every day for a week and then tally it up. If you're not burping more than you're burping, there's a problem. And then what do? So, yeah, I'll answer my own question since I mentioned that. What do? You look at that list of 8 things and figure out what is it that's out of balance? What am I lacking? And get it balanced back into the equation. Go ahead. Good. Hydration is good. Okay. You drink an alkaline water. It could be if you drink it right before a meal. Yeah, I would just be careful around mealtime, before and after, because you don't want to dilute, right, your hydrochloric acid. So, yeah, it's great to drink otherwise, but if you're eating 5 to 6 times a day, it might be kind of hard to time that, but you're good. You've got skills. All right, should be less than 3 minutes that you get a burp. If you lack hydrochloric acid, what do? Address your deficiencies: zinc, iodine, magnesium, potassium, autonomic nervous system balance, salt, water, vitamin B1. Or check if there's a dental short circuit or maybe a foot short circuit, right? Supplement with hydrochloric acid or other digestive enzymes before each meal until you figure out what the problem is and you start making enough of your own acid. Okay, add digestive bitters, decrease refined sugar, increase apple cider vinegar, manage your stress so your teeter-totter is more balanced. and identify the stressors that are contributing to your lack of hydrochloric acid production. Okay, remember every tooth is connected to an organ. Very important to take a look at the first molars and the lower premolars because they sit right on that stomach meridian. And the premolars down here. Remember, that's what we're shooting for, is a closed circuit. Caries risk, lack of omega-3s. We'll talk about those here shortly. Poor bile formation, poor liver function, poor pancreas function, high A1C, diabetes, and imbalanced foods, refined processed foods, regular intake of carbonation, caffeine, imbalanced autonomic nervous system, saltwater zinc deficiency, heavy metals infection, sleep disorder breathing, and unmanaged stress. Okay. IOMT put this statement out a couple years ago, 3 years now. Metal-induced inflammation may be involved in the pathology of various autoimmune and allergic diseases, fatigue, joint and muscle pain, and impairment. We saw that verified just 2 hours ago. Brilliant, by the way. I'm still just floating. Can you see how high I am? I'm like 3 feet off the ground. All right, here's the paper Sammy sent to y'all, FDA 2019, biologic responses to metal implants. These are some of their findings. Implant alloys continue to contribute to biofilm formation, pathogenicity of bacteria. They promote carious lesions, gingival disease. Nickel elicits biofilm. Biofilms elicit an acidic oxidizing environment. Then you get LPS formation, which further corrodes the alloys. Then you get tribocorrosion, which further corrodes the alloys. Microbes and biofilms create a chronic low-grade inflammatory response. And then that signals this cascade that goes on, and people just get sicker and sicker and sicker until they go into their doctor and the doctor says, well, you're crazy. It can't be your titanium. I'll show you a case here in just a second. Neutrophils get involved, metal reactivity. Remember this as I show you this case. May result in generalized pain, fever, syncope, palpitations, arrhythmias, serosal effusion, vasculitis, hair loss, poor wound healing, dermal rash, eczema, etc. So, true story. My neighbors are among the top 3 hardest people to treat, in my opinion. Wives are at the top. Yeah, my wife's not out there, but she would own it. They are really hard to treat because neighbors in particular, because you know, they've watched you in the neighborhood. You know, they see you out pulling weeds. They see you out yelling at your kids. You're just a normal dad to them, right? Or mom. Anyway, she came in and she said, you know, I just had this root canal done and I had it retreated and it's really hurting me, right? So what am I going to say? You got 3 options, right? Leave it in, ignore it, get it retreated, take it out. I told her to take it out. That's what I would do. She didn't like that. She's a pharmacist, and so she went to see an oral surgeon. Disappeared. I only know she went to the oral surgeon because of what happened afterwards. But she disappeared. I didn't see her in the neighborhood. I thought, did she die? What happened? But then she came back. In pain. I'll show you the story in a little bit. Horrible pain. Worst pain that I've seen in almost any of my patients. What happened? Well, here's what happened. 14, extracted by an oral surgeon. He put in a titanium implant. Shortly after that, she developed what's called Sweets syndrome. I'd never heard of this, but it's basically sudden onset of fever, painful rash all over the body, eye twitching, local and systemic pain. The technical term is acute febrile neutrophilic dermatosis. Are you familiar with that, Doc? You've heard of it, yeah. I had never heard of it. This was the first time. She spent many nights in the hospital trying to control the pain, anxiety, infection from the rash, and everybody was saying what? Oh, let's just get you on some anxiety medication because it's all in your head. You know, you're just crazy. Oh, I don't know. She went through so many different things. But the last recommendation after they tried all those other things was you need some medication because you're overreacting. So but she knew what the problem was because all this started right after that implant went into her head. So she went back to the oral surgeon and basically begged him to take it out of her head. Well, he went in there with a carbide. I don't remember those details. I just remember seeing her after this happened. And he just went up and he routed it out, sent titanium shards everywhere. Okay? She literally went into shock for the next 6 months. And through this, all the docs she's seeing are saying what? Oh, you're crazy. You just need some medication to calm your nerves. Let's get you on some, I can't remember. Oh, they tried to put her on so many different dumbing down drugs so she couldn't actually feel like she's human. Anyway, she was in sympathetic overdrive from what? The histamine storm. All these mast cells are activated and they just dump histamine in the system. And I'll show you some more pictures coming up. It's at this point where she's just desperate for care that she came back again for a second opinion, if you will. All right, so she had scarring like this, all up and down her neck, over her breasts and her back, all over the place. So we did lots of ozone, procaine, and we use procaine to help patients get out of sympathetic into parasympathetic. It's a great little drug to have on hand to make that happen. And what's that? No, I just did it around. Actually, you do put procaine in the IV. I do that routinely, 2 cc's, either 1 or 2%. What's that? Oh, you get an awesome flush. It's amazing. I love that. That's like, nirvana. All right, so trying to get her into parasympathetic balance. She had a dream. She said, I know what you need to do. I said, okay, please tell me. She said, there are all these little particles up there. I can feel them. You need to go in there and get them out. I said, okay, knowing what the oral surgeon had done. And I thought, how am I going to do that? And then I realized I got a laser. I've actually got 4 lasers. I can only use one of them at a time, but I can go in there and get this stuff out. So we did. What's that? This is about a 2-hour surgery, just going in there, painting every surface with the erbium YAG. And hopefully you can see the metal splinters flying out of there as you see the fireworks flying out of there? So it was a couple hours. I peeled that back. And by the way, there was no Schneiderian membrane. It was just fibrous tissue. So I had to fillet that fibrous tissue in half and actually make her a new membrane and then lift that after I got all this cleaned out and backfill it with, I think I just used some of Steiner's tricalcium phosphate, and then do some tissue brushing to get primary closure. But yeah, sparks flying. That was all over. There's no way I was going to get all of that out of her sinus. So I was really frank with her. I said, you've got particles in there that your body is just going to take time to get out. These little pseudo cilia that are in the sinus are just going to, and this is about 1,000 times as fast as they move. You're going to take time to move all that stuff up and out of your maxillary sinus. All right. So right after the surgery, she said, I've got my life back. Thank you. This is the best I felt in 2.5 years. Pain is gone. The sympathetic is gone. She's in parasympathetic. And I don't want to touch her again. This is where she currently stands. There's no implant in there. I'm going to say, if I were you, just leave it alone. Especially wait until you feel like this is completely clear. Because I'll see her at church once in a while and she'll say, yeah, I felt another splinter come on up and out. And some of them she can actually see come out. But these are so small, these particles, you can't see. At one visit, she came in and her eye had swollen up like this. One of the particles had made it up. And how did that happen? Histamine storm is still going on. Inflammation, right? The nickel. Most people are sensitive to the nickel. All right, remember, titanium implants are not 100% titanium. All of them contain nickel. What did you tell me, like 0.03%? Well, how much nickel does it take for somebody to have a reaction? Less than that, probably. All right. Oh, also the aluminum and the vanadium, we haven't even talked about those. These are alloys, they're not just titanium. Okay, Hyacin implants, 6% aluminum, 4% vanadium. Nobels. Oh, this kills me. As in most metal compositions, there may be trace elements of other elements that we don't have to list. But beware, piled chips and burrs may burn vigorously. Do you think, after seeing that case, do you think they're going to burn vigorously? I bet she'd love to have that 2.5 years of her life back. All right, this is the bottom line from the FDA. This updated, more holistic view, this is a straight quote out of their paper, indicates that inflammatory responses elicited by implant presence and/or its debris, there's plenty of that going around, employ both innate and adaptive types of immunity. Success or failure involves complex immunologic crosstalk that may propagate dysregulation of pro and/or anti-inflammatory balance and result in clinical manifestations. That's what we see, right? So don't use titanium and get it out of people's heads if they choose to so do. Titanium ions are deposited systemically and can lead to toxic reactions. Implanted Journal Dentistry, 2019. Another patient, I feel like I have infection in my jaw. Dentists say there's nothing there. This is the area. There's nothing there. That pus is all in your head. Well, they're partly right. Physiologically, it is in the head. Emotionally, it's not. I've had a low-grade fever for 5 years, and I have some heart issues. What do you think about this? Does she just have bad oral hygiene, or what's going on? Say that louder, Mike. Yeah, right. Calcium and phosphorus will be deposited, especially on the lower anterior incisors, lingual, when there is a gut dysbiosis, because the calcium and phosphorus are not going where they need to go. So if you see somebody with heavy calculus buildup, have a frank discussion about digestion. Touch on the points that we've discussed here. So here's what we see. Yep. Oh, but that integration looks pretty good. Well, did you consider she might be sensitive to the metals in that alloy? This is the healing cap that was put on that titanium implant. What do you see on this? What's this stuff? Okay, one of my favorite words, purée. Everybody repeat that, and you'll never forget. Purée. Pus. Right? Why would you have pus on a healing cap? Yeah, body's trying to get it out. Yuck. That's what's going on. When you have 2 or more dissimilar metals, you create 100% of the time a battery. And whenever you have a battery, 100% of the time, simple physics, you get corrosion. And look at these possible batteries. You got the implant to the screw, you've got the abutment to the screw, the implant to the abutment to the crown, the crown to crown, crown to filling. Couldn't do that all in one breath. Implant to filling, implant to crown, screw to crown, and implant. Who other knows what other body implants, right? Yeah, I personally wouldn't want that in my body. So no metal, anything, right? The only possible Exception would be temporary metal with orthodontics, right? If you've got a severe malocclusion, it's a possibility, but that's not something permanently implanted in a patient. Okay, pitting corrosion from galvanism. This is in that patient. Look at all these pock marks from the cattle prod being zapping. That's from the screw attaching, and who knows what metals are in the screw versus the implant. They're not the same material, most likely. And so you get pitting corrosion and then all the pus that goes along with that. And then this is the implant right after I removed it. Where's Sammy? Sammy, you in here? Okay, well, I'll just tell you. So Sammy and Dr. Lechner published a paper in 2019 showing that these titanium implants are a main source of Rontes and CCL5. That's significant. You know how many titanium implants are placed in the United States alone every year? Yeah, I won't use that word, but I agree. A boatload, several boatloads. Okay, osteoclasts corrode titanium surface and they absorb metal ions. Titanium is toxic to osteoblasts. Dissolved titanium creates a unique niche for microbiota, so you're going to get a whole brand new generation of bacteria that who knows what they're capable of. Titanium is released into the tissues, 30 times higher release of Rontes around titanium implants than in healthy bone. 30 times higher. This is from that study reference. So here's the titanium implant. There's the fatty necrosis. If you were to test that and see how much Rontes you have, how much would you have compared to the healthy bone? 30 times higher. That's what they found. Case after case after case. Okay, and you see these titanium shards left behind. And it's not an innocuous material. Get TNF alpha initially, huge release, and then over time that switches over, decreases, and then Rontes levels skyrocket. Another implant, this is typical. Right after taking it out, you can see all the fatty degenerative tissue that was still attached to the implant. I got 5 hours left. Perfect. I can do that. All right. All right. Yeah, fuller Rontes. So yes, we need to be considerate. Okay, wisdom teeth. My opinion here is leave them alone unless they're causing a problem. And I agree with this. The fact that most third molars, impacted or not, do not become diseased, and that the risk of iatrogenic injury from such surgery is greater than the risk of leaving asymptomatic, non-pathologic teeth alone does not override the expert opinion of oral and maxillofacial surgeons. Thus, the prevalent practice of prophylactic third molar extractions is ordained as the standard of care, even though that standard is based on an erroneous evaluation of at all outcomes and costs. So if they're not causing a problem, leave them alone. Then we don't have to clean up any cavitations afterwards. Mercury will zip through this, negatively affects gut flora, neurotoxic. Scan that if you want to know more. I think we're all of the same mind there. This is one of my favorite. I don't even know what to call it. You'll see in the next slide. According to the ADA, it's unethical to remove amalgam. It is ethical to remove amalgam for aesthetic reasons. This is straight out of the Code of Ethics. Amalgam is safe because it's been used in over 100 million patients. That sounds pretty scientific to me. There's no scientific evidence that amalgam harms health. I think I just showed you 3 or 4 studies that published recently.
What you just said is one of the most insanely idiotic things I have ever heard. At no point in your rambling, incoherent response were you even close to anything that could be considered a rational thought. Everyone in this room is now dumber for having listened to it.
What can I say? All right. So when the label has, this kind of stuff on it, that doesn't set well with me. Chronic low-level mercury exposure, proven, causes neurologic disturbances, memory problems, skin rash, kidney abnormalities, straight out of the CDC. Okay, contributes to cardiovascular disease. This was just published last year. Increases triglycerides, low density lipoproteins, which is going to negatively affect your bone growth. So if you've got an amalgam sitting right next to an edentulous spot where you're considering placing an implant, you better strongly consider getting rid of that toxic alloy before you dig into the bone. Mercury contributes to autoimmune responses, again, published last year. And we dentists use the most elemental mercury of anyone. Be careful, it's a significant source of contamination, so make sure you remove it safely. This just showing toxic tooth from iomt.org, their website, just showing the mercury vapors that come off after the tooth, the fillings heated up to, like after drinking a cup of coffee or hot drink or hot soup. Metals induce toxicity. There's a compilation of a bunch of systemic effects of metals in the mouth. You can take a snapshot of that if you want. Only took me several hours to put that together. I don't see many phones, but that's okay. Yeah. I mean, look at some of these. Metals in the mouth cause precancer changes in oral tissues. Anybody recognize that journal? O. It's one of the most renowned journals in dentistry. Metals in the mouth affect immune response. Let's see, how many of you saw a patient with autoimmune thyroiditis last week? Everybody better raise their hand. Even if you didn't realize you saw one, you did see one. It is rampant. Thyroid problems are a huge, huge issue. Sammy, I'm going to have a really hard time stopping here. Mercury can cause toxicity. Implants, having multiple systems is important. I use them all except for Straumann. I think they were a little late to the game, but you got lots of different options. They're great companies and all have their respective pros. So full toolkit. I love adding PRF. See, I just drop it on there. Nothing touches it except the patient. Now that mixture also has the melatonin and metronidazole mixed into it. Titanium is released twice as much more from titanium implants than zirconia is from implants. Titanium showed more cytotoxicity and DNA damage to human cells. And you see this all the time. You just touch on that and you see pus come up. Why would pus come up around a material that is supposedly the standard of care? Because something is not right, regardless of whose ego is at stake. Incidence of periimplantitis, anywhere from 1 to 85%, depending on who you read. Journal of Periodontal Research, 2018, largely due to corrosion. More pitting, you're going to see this all the time. Pop these out, put it under the microscope. Brontes associated with titanium. Let's see, is this yours, Sammy? Yes, there's your name right there. It was just in small print. With Dr. Lechner, they found upregulation right after you place the titanium implant. Because of the dissolved titanium, you get an upregulation of TNF alpha, and then over the next few months, years, then you get down a lowering of the level of TNF alpha because all the bone sclerosed, scar tissue, and an upregulation of Brontes, which is associated with all of these things. Okay, you're going to see this all the time. Corrosion, pus. Look at the pitting on that and the pus. I wouldn't want that in my mouth.
What's your favorite way to success?
Yeah, I use laser. I use the Neobiotech. I use BTI has a system, so I use whichever one fits the best. or whichever one my assistants can find. Piezo, not routinely, but you can. I am concerned about hard substance bone and heat generation or releasing more titanium particles. According to the literature, there's an article published, I'm not sure I have it in here. According to the literature, the one that I'm referencing, the best way to remove it is reverse torque. Why? Because you're not introducing more titanium particles to create more inflammatory response. Okay, monoblock, survival rate. Yeah, I think we're all convinced 3 years post-insertion. That looks like a natural tooth. 4 years post-insertion. 8 years, this was actually the first implant I ever placed. This was in 2010, and it was an immediate. I just will never forget, I'm sure the patient won't either, but me walking up to her with my hand shaking, and she said, "Are you sure you know what you're doing?" And I said, "Absolutely, don't worry, this is the first time I've ever done it." She was a good sport, but still in function. That was one of the old Z-Look implants when they first got FDA approval. Fibroblasts attached to zirconia. 19 articles show zirconia implant failure rates. Early, 3.4%, late, 1.7%, and fracture, 1.7%. 71 implants, 5-year survival rate, 98.4%, marginal bone loss minimal. That is right there rationale for doing immediate implant placement. You're going to minimize your crestal bone loss. Okay, zirconia versus titanium, same clinical success, quote unquote, after 80 months without the systemic toxicity. Okay, we want to get people out of that sympathetic. And I think my time is up, although it saddens me to not share some of the other meat in the presentation. So there you go. Look at that, 6:01, not too bad.
Thank you.
You want to, I'm happy to.
You always have these very, very, very nice presentations. So